Blood clots. This video examines risks, symptoms, and treatments. Blood clots are gel-like clumps of blood that form in response to injury or to prevent excessive bleeding. While they are a natural part of the body's healing process, blood clots can sometimes form inappropriately inside veins or arteries, leading to serious health issues. Understanding the causes, risks, symptoms, and treatments of blood clots is essential for preventing complications and ensuring timely medical intervention. This video drills into the various aspects of blood clots, including their formation, potential dangers, and management strategies. What are blood clots? A blood clot, also known as a thrombus, is a mass formed by platelets, fibrin, and other blood cells that stick together to stop bleeding. Blood clots are essential for wound healing and preventing excessive blood loss. However, when blood clots form inappropriately within blood vessels, they can obstruct blood flow and lead to serious medical conditions. Types of blood clots. Blood clots can form in veins or arteries, leading to different types of conditions. Venous thromboembolism, VTE. VTE is a condition where blood clots form in the veins. The two main types of VTE are deep vein thrombosis, DVT, a clot that forms in the deep veins, usually in the legs. DVT can cause pain, swelling, and redness. Pulmonary embolism, PE, a potentially life-threatening condition that occurs when a clot breaks free from a vein, often from a DVT, and travels to the lungs, blocking blood flow. Arterial thrombosis. Arterial thrombosis occurs when a clot forms in an artery. This can lead to conditions such as heart attack, caused by a clot blocking blood flow to the heart. Stroke, caused by a clot obstructing blood flow to the brain. Peripheral arterial disease, PAD, caused by clots in the arteries supplying blood to the limbs, often leading to pain and cramping. Causes and risk factors. Several factors can increase the risk of developing blood clots, including medical conditions, lifestyle choices, and genetic predispositions. Medical conditions. Cancer. Certain types of cancer and cancer treatments can increase the risk of blood clots. Heart disease. Conditions such as atrial fibrillation and heart failure can promote clot formation. Surgery. Major surgeries, particularly those involving the legs, hips, or abdomen, can increase clotting risk. Pregnancy. Hormonal changes and pressure on veins during pregnancy can elevate the risk. Obesity. Excess body weight increases the pressure on veins and can lead to clot formation. Chronic conditions, diseases like diabetes, inflammatory bowel disease, and autoimmune disorders can increase clotting risk. Lifestyle factors. Immobility. Prolonged periods of inactivity, such as long flights or bed rest, can slow blood flow and increase clot risk. Smoking. Smoking damages blood vessels and promotes clotting. Dehydration. Dehydration thickens the blood, making clots more likely. Genetic factors. Inherited clotting disorders. Conditions such as factor VUV-Leiden mutation and prothrombin gene mutation increase the risk of abnormal clotting. Family history. A family history of blood clots can indicate a higher genetic predisposition. Symptoms of blood clots. The symptoms of blood clots vary depending on their location and severity. Early detection and treatment are crucial to prevent complications. Deep vein thrombosis, DVT. Symptoms of DVT typically occur in the affected leg and may include swelling. Swelling in one leg, usually in the calf. Pain. Cramping or soreness that may start in the calf and feel like a pulled muscle. Redness. Red or discolored skin on the leg. Warmth. Warmth in the affected area. Pulmonary embolism, PE. Symptoms of PE can be severe and life-threatening, requiring immediate medical attention. Shortness of breath. Sudden and unexplained difficulty breathing. Chest pain. Sharp stabbing pain that may worsen with deep breaths. Cough. A cough that may produce bloody or blood-streaked sputum. Rapid heartbeat. Increased heart rate or palpitations. Arterial thrombosis. Symptoms of arterial thrombosis depend on the location of the clot. Heart attack. Chest pain or discomfort. Shortness of breath, nausea, lightheadedness, and sweating. Stroke. Sudden numbness or weakness, especially on one side of the body. Confusion, trouble speaking, vision problems, and severe headache. Peripheral arterial disease, PAD. Leg pain, cramping, numbness, and coldness in the affected limb. Diagnosis of blood clots. Diagnosing blood clots involves a combination of medical history, physical examination, and diagnostic tests. Medical history and physical examination. Doctors will assess the patient's medical history, including risk factors and symptoms, and perform a physical examination to check for signs of blood clots. Diagnostic tests. Ultrasound. a non-invasive imaging test that uses sound waves to detect clots in veins, commonly used for diagnosing DVT. D-dimer test, a blood test that measures the presence of a substance released when a blood clot breaks up. Elevated levels may indicate clot formation. CT pulmonary angiography, a specialized CT scan that provides detailed images of blood vessels in the lungs, used to diagnose PE. MRI, magnetic resonance imaging, can be used to detect clots in veins and arteries. Venography, an imaging test that uses contrast dye to visualize blood flow and detect clots. Treatment of blood clots. The treatment of blood clots aims to prevent their growth, reduce the risk of complications, and address the underlying causes. Treatment options vary depending on the type and severity of the clot. Anticoagulant medications. Anticoagulants, also known as blood thinners, are commonly used to treat and prevent blood clots. These medications reduce the blood's ability to clot, preventing new clots from forming and existing clots from growing. Heparin, an injectable anticoagulant used for immediate treatment. Warfarin, an oral anticoagulant used for long-term management. Direct oral anticoagulants, DOACs. Newer oral medications, such as rivaroxaban and apixaban, that require less monitoring than warfarin. Thrombolytic therapy. Thrombolytics, also known as clot-busting drugs, dissolve blood clots quickly. They are used in emergency situations, such as severe DVT or PE, when rapid clot removal is necessary. Tissue plasminogen activator, TPA, a commonly used thrombolytic agent. Mechanical thrombectomy. Mechanical thrombectomy is a minimally invasive procedure used to remove large clots from blood vessels. It involves using a catheter to physically break up and remove the clot. Example: mechanical thrombectomy is often used to treat severe cases of PE or strokes caused by arterial clots. Compression stockings can help prevent and manage DVT by improving blood flow in the legs. They apply gentle pressure to the legs, reducing swelling and promoting circulation. Example: compression stockings are recommended for patients at risk of DVT, such as those undergoing surgery or on long flights. Lifestyle changes. Making certain lifestyle changes can reduce the risk of blood clots and improve overall vascular health. Regular exercise. Physical activity helps improve circulation and prevent clot formation. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins supports vascular health. Hydration. Staying hydrated prevents blood from thickening and reduces clot risk. Prevention of blood clots. Preventing blood clots involves addressing risk factors and adopting healthy habits. Here are some key prevention strategies. Stay active. Regular physical activity helps maintain healthy blood flow and prevents clot formation. Aim for at least 150 minutes of moderate intensity exercise per week. Walking, swimming, cycling, and yoga are excellent activities for promoting circulation and preventing blood clots. Maintain a healthy weight. Achieving and maintaining a healthy weight reduces the pressure on veins and lowers the risk of clot formation. A balanced diet and regular exercise can help achieve a healthy weight and reduce the risk of blood clots. Stay hydrated. Drinking plenty of water helps keep blood thin and reduces the risk of clot formation. Aim for at least 8 8-ounce glasses of water per day. Carry a water bottle with you throughout the day to stay hydrated and prevent blood clots. Avoid prolonged inactivity. Avoid long periods of immobility, such as sitting or standing for extended periods. Take breaks to move around and stretch regularly. On long flights, get up and walk around the cabin every hour to improve circulation and reduce the risk of DVT. Wear compression stockings. If you are at risk of DVT, wear compression stockings to improve blood flow in your legs and prevent clot formation. Compression stockings are particularly useful for people who travel frequently or have a history of blood clots. Avoid smoking. Smoking damages blood vessels and increases the risk of clot formation. Quitting smoking can significantly reduce the risk of blood clots and improve overall health. Seek support from healthcare professionals, support groups, or smoking cessation programs to quit smoking and reduce the risk of blood clots. Blood clots are a serious medical condition that can lead to life-threatening complications if not properly managed. Understanding the causes, risk factors, symptoms, and treatment options is crucial for preventing and addressing blood clots effectively. By adopting healthy lifestyle habits, staying active, and seeking medical advice when necessary, individuals can reduce their risk of developing blood clots and maintain optimal vascular health. Early detection and timely intervention are key to preventing complications and ensuring a positive outcome. As medical research continues to advance, new treatments and prevention strategies will further enhance our ability to manage blood clots and improve overall health. If you received value from this video, please like and subscribe to the channel.